Hi, my name's Kate. I'm going to be your nurse today. Today I'm going to be examining your stomach, your upper, lower extremities, your hips, your spine, checking your cranial nerves just to make sure everything's intact, okay?
Okay.
I'm going to start off by saying you're a well-appearing female. Skin color is appropriate for ethnicity. Can you tell me your first and last name?
I'm Nikki Trumbull,
Can you tell me your date of birth?
11/17/87.
Okay, and where are we right now?
We're in Park Ridge.
Okay, so you're alert and oriented ×3. Alright, so I'm going to start off by having you lay back. I'm going to assess your abdomen, okay? I'm going to start by just inspecting it. Just move your hands to the side, thank you. So upon inspection, the skin is intact. There's no distension, no visible scarring, no abnormal hair, nothing like that, which is all normal findings. Now I'm just going to take a listen to your bowel sounds, okay? Starting in the left lower quadrant, I'm going to listen until I hear a sound, and I'm going to work my way across the floor, okay?
Okay.
Okay. All your bowel sounds are either normal or active. Now I'm going to listen to your abdominal aorta, okay? With using the bell of the stethoscope. Okay, and now just the renal arteries. Okay, no bruit noted. Now I'm going to just palpate your stomach, okay?
Okay.
All right, I'm going to feel for your liver. Okay. Any pain when I press? Liver is at the border, 7 centimeters, which is normal. I'm going to feel for your spleen. I'm going to put my hand under you and palpate. Any pain when I press?
No.
Okay, no masses. Okay, that's a normal finding. Now I'm going to do light palpation first. Tell me if you have any pain. If not, we'll move on to deep palpation, okay?
Okay.
Again, starting in the right lower quadrant. Any pain?
Nope.
How does that feel?
Feels good.
All right, so now we're going to do a little bit of deeper, okay? And tell me if you have any pain when I press or release. No?
Nope, no pain.
Okay, good. Now I am going, okay, so you can have it set up for me now. Your abdominal assessment was all normal, okay?
Okay.
Now we're going to start with your upper extremities. I'm just going to take a look at your clavicles. Come back here. Any pain when I touch your back here?
No.
All right, so now we are going to... I'm going to have you shrug your shoulders, feel the shoulder joints. Any pain when I touch there?
No.
Any pain when I touch your elbows?
No.
Any pain when I touch your wrist?
No.
Okay. So we're going to do some range of motion and some strength, okay? So I already checked your shoulders. Put them up for me. Press against me. It was strong. I'm going to have you bring this arm all the way up. Any pain when you do that? No. Okay. Bring the other arm all the way up. Any pain when you do that?
No.
All right. I'm going to have you go like this. Extend. Perfect. Any pain there?
No.
Wrist up, down. Okay. I'm going to have you press down against my hands. Good. Press up against my hands. Good. And then I'm going to go like this and press down. Good. Press up. Good. Checking for your elbow joints. Okay. No pain, nothing. Everything felt okay. There was no clicking. No noises heard. Okay. So now I am going to do your reflexes. We're going to start with your bicep. I'm going to use this hammer. Okay, I'm going to put my hand here, and what I'm looking for, I'm going to hit it lightly with my hammer, and I'm going to make sure that this tendon contracts, okay? Ready? Good. Side. Good. Okay, now I am going to do your wrist. Good. Good. All right, so now we are going to, I'm going to feel for your pulses, your radial pulse over here, +3, your brachial pulse. Good. Okay, now we're going to do your tricep reflex, okay? I'm just going to dangle your arm here. I'm just going to hit right here. Good. Same on this side. Good. All your reflexes are intact. Your strength was all normal. Your range of motion was all 5 out of 5. Now I'm just going to palpate your hands, okay? No clubbing is noted to the fingers. Cap refill is less than 3. No nodules noted. Skin is intact. Do you ever have any pain in your fingers or anything?
No.
No? Okay. I'm going to have you press it down on my hands, up on my hands, and then flex. Good. Good. Now I'm going to have you lay down. One more time, I'm going to palpate your hips, okay? All right. Do you have any pain when I touch?
No.
All right, I'm going to have you lift up this leg, bend it a little, abduct and adduct. Okay, good. Any clicking, any pain? No. Same with this side. Good. Range of motion is 5 out of 5. Now, I'm going to have you sit up. I'll help you. We're going to start with your lower extremities, okay?
Mm-hmm.
I'm going to inspect them. They're symmetric. Your skin is intact. Do you ever have any pain with your extremities?
No.
Lower extremities, your knees, your ankles? No? Okay, so we're going to start. I'm going to have you take this leg,
Mm-hmm.
hold it out,
Mm-hmm.
and then like this,
Oh.
and flex in, extend. Okay, same with the other one. Flex in, extend. Ankles up and down, flex and extend. Okay. I'm going to check your reflexes, okay? I'm just going to do your knee. Okay, and do your knee over here. Okay. I'm going to feel it for your pulses. Okay, +3. +3. I'm going to check your ankle while I'm down here. Okay. +5. Out of 5 for your reflexes. I'm going to do the Babinski sign, okay? So I'm just going to take the end of this, swipe up, see if your toes curl, okay? Okay. Okay, Babinski is negative. Now I'm going to have you, I'm going to press down on your legs. I want you to try to bring them up, okay? Good. And now try to kick them out. Okay, try to bring them back. Try to push down. Okay. All right, now I'm going to, your ankles and your feet have no edema. Do you ever have any pain down here?
Nope.
Skin is all intact. Color is appropriate, no swelling. Your posture, I'm going to come back here and look at your spine. Posture is straight. I'm just going to feel, okay?
Mm-hmm.
Any pain?
Nope.
All right, I'm going to have you lay back a little, sit up. Good. Range of motion is good. Have you go to one side, the other side. Range of motion is good. So now I'm going to have you, I'm going to check your cranial nerves, okay? So there's a couple of them, but we're going to start with number 1. I'm going to, which is your cranial nerve 1 is your sense of smell, okay? So I'm going to have you close your eyes. I'm going to wave something under your nose. You tell me what you smell.
Peppermint.
Perfect. So cranial nerve 1 is intact. Cranial nerve number 2 is your vision. So I'm going to hold this, and you're going to tell me which is the lowest line that you can see. It's going to be 20 feet away, okay?
Okay.
Cover your one eye. Tell me the lowest line.
CFDHJ.
Okay. Cover your other eye. Lowest line.
CFDHJ.
Okay. Vision is 20/25, which is perfect. All right. Now I'm going to have you look straight at me. I'm going to put a number in your visual field. You tell me what you see, okay? Cover one eye.
1.
Okay. Cover the other eye. We're going to do the same over here.
2.
Perfect. So cranial nerve 2 is intact. Now for cranial nerves 3 through 6, I'm going to check to see how your pupils, if they're reactive to light, and your visual fields. Make sure there's no extraocular movements, okay? So first you can look straight ahead. I'm just going to move this closer. Stare at the pen. Okay, I didn't notice any extraocular movements. Now I'm going to check your visual fields just by moving this. Follow the pen. Don't move your head though, okay? Okay, no movement, extraocular movements noted. I'm going to have you stare straight at me, and I'm just going to check to see how your eyes react to light, okay? Okay? Okay, pupils are +3, brisk and responsive. Perla is intact. So cranial nerves 3 through 6 are intact. I'm going to check cranial 5 now, which is your facial sensation and your masseter muscles, okay? So you feel me touching your face?
Yes.
Okay, I'm going to have you open your jaw, close your jaw. Any pain with that? No? Okay, cranial 5 is intact. Now we're going to do cranial 7, which is your facial movement. We did that with the open the jaw. I'm just going to have you smile, make sure everything's equal. Perfect, close your eyes. Okay, facial movements are all symmetrical. We're going to do number 8, which is your hearing. I'm going to occlude one ear, whisper something, tell me what you hear. We're going to do it on the other ear, okay?
Okay.
All right, we're going to start with this side.
Apple.
Okay.
Banana.
Okay, cranial nerve 8 is intact. Now we're going to do 9 and 10. So I'm going to look in your mouth with a stethoscope. Make sure your gag reflex is intact. Also going to be looking to see if your uvula moves up once you open your mouth and when looking, okay? Okay, uvula moves up. Okay, gag reflex is intact. Cranial nerve 9 and 10. Your swallowing is okay. I don't hear any hoarseness, so 9 and 10 are intact. Now for number 11, I'm going to have you move your head from side to side. Any pain?
No.
Up and down? Any pain?
No.
It's all smooth movements. Cranial nerve 11 is intact, and before we had you shrug your shoulders, and that was intact too.
Mm-hmm.
Okay, now for number 12 is your tongue. I'm going to have you stick your tongue out, move it up, move it down, side to side. Okay, so cranial nerve number 12 is intact. So now I'm going to have you do your skin is all warm to touch everywhere. Okay, I'm going to have you stand up for me. And I'm just going to have you walk towards me like you normally would. Okay, great. Heel to toe, perfect. Gait is steady. I'm going to have you walk on your heels towards me. Okay, balance is good. Gait is steady. I'm going to have you walk on your tippy toes to me. Okay, perfect. Good job. Thank you. I'm going to have you stand with your arms straight out in front of you. Close your eyes. Okay, no drifting noted. Okay, good job. You can have a seat. That's a normal finding. All right. Do you have any questions?
No.
We checked all your cranial nerves. They were all intact. Your complete abdominal assessment was all normal. We did all your range of motion. You have good, strong, equal muscle movements, good range of motion, no pain on anything. So if you don't have any questions, I think that's all, okay?
Thank you.